Have you ever found yourself glancing in the mirror, perhaps noticing a new spot or a tiny change on your skin, and just brushed it off, thinking, "Oh, it's just a sunspot," or "That's probably nothing new at my age"? It's easy to do, isn't it? We all get new marks as we age, and our skin tells the story of our lives. But sometimes, those seemingly innocent changes can be whispering a silent, urgent message. A message that, if we don't listen, could lead to something much more serious down the line. We're talking about something as critical as the early signs of skin cancer, which often doesn't make itself known with pain or discomfort until it's much more advanced. The painful reality is, many people miss these subtle cues simply because they don't know what they're looking for, or they dismiss them as harmless. Today, we're going to pull back the curtain on some of these quiet signals your body might be sending you, those silent signs that many of us might simply ignore or misinterpret. It's not about alarming you, but empowering you with knowledge, turning you into the best possible detective for your own health. In this video, we'll uncover specific changes and marks on your skin that truly deserve your attention, not just the obvious ones, but the subtle whispers your body might be sending you. We'll explore what to look for, why it matters, and what proactive steps you can take to protect yourself. Make sure you watch right to the very end, because there's one particular sign we'll discuss that might truly surprise you, something many people never even consider. Let's begin by tuning into our skin, becoming better detectives of our own well-being, starting with the most well-known but often misunderstood changes, particularly concerning moles. We've all got moles, some since birth, others popping up over the years. But some moles demand a closer look, especially if they start behaving differently. Think of it like this: your skin is telling a story, and sometimes, a single chapter in that story suddenly takes an unexpected turn. The first thing we need to understand is what's often referred to as the ABCDE rule for checking moles. A simple but powerful tool to help you spot potential trouble. The A in ABCDE stands for asymmetry. Imagine drawing a line right through the middle of a mole. If both halves don't match, if one side looks distinctly different from the other in shape or size, then it's asymmetric. Most benign, harmless moles are usually symmetrical. If you cut them in half, they'd look pretty much the same on both sides. But a mole where one half seems to have a mind of its own, growing or looking different from the other half, that's a red flag. It's like a piece of a puzzle that just doesn't quite fit anymore. It doesn't mean it's definitely cancer, but it means it's definitely worth a closer look by a professional. Next, we come to B, for border irregularity. Take a moment to look at the edges of your moles. Do they have a smooth, well-defined border, almost like a perfect circle or oval? Or are the edges ragged, notched, blurred, or scalloped? Think of it like the coastline of a healthy island versus a coastline that's been battered by storms, with inlets and jagged edges everywhere. A mole with an irregular or poorly defined border is a significant warning sign. It suggests uncontrolled growth, which is exactly what we're trying to identify early. This isn't about perfect circles. Natural moles can be slightly oval, but their edges are typically neat and consistent. If it looks frayed or like it's spilling out unevenly into the surrounding skin, pay attention. Now, C is for color variation. This is a big one, and often quite telling. A benign mole usually has a single, consistent shade of brown or black throughout. But if you notice a mole that has multiple colors within it, different shades of tan, brown, black, or even unexpected patches of red, white, or blue, that's a serious concern. It's as if someone took a paint palette and dabbed various colors onto one spot. Sometimes, it might just be a very dark spot mixed with a lighter one, or a faded center with darker edges. Any mole that isn't uniformly colored, that seems to have a mix of hues, warrants immediate medical attention. This variation suggests different areas of growth or cell activity within the mole. Moving on to D, which stands for diameter, generally speaking. Moles larger than 6 millimeters, that's about the size of a pencil eraser, should be viewed with a little more suspicion. While smaller moles can certainly be cancerous, and size isn't the only factor. A mole that is already quite large, or one that has been growing in size, is definitely something to note. Imagine checking your skin regularly if you find a new mole, or an existing one. That's noticeably bigger than most of your other moles, especially if it exceeds that 6 millimeter mark. It's worth getting checked out. Size alone isn't a deal breaker, but combined with other signs, it becomes more significant. And finally, E for evolving. This might be the single most crucial letter in the ABCDE rule. Evolving means any change in the mole's size, shape, color, or elevation. Perhaps it used to be flat and now it's raised, or it felt smooth and now it's rough. But evolving also includes any new symptom associated with the mole. Has it started to itch? Is it tender to the touch? Has it begun to bleed, or ooze, or develop a crust? Any mole that is changing, or presenting with new sensations, even if it's small or otherwise seems normal, is a major red flag. This is your skin telling you something new is happening. It's a dynamic process, and even a tiny shift can be vitally important. So, if a mole that has been stable for years suddenly starts to itch, bleed, or simply looks different in any way, that's your cue to get it looked at promptly. So, how do you put this into action? It all starts with a regular skin self-exam. Make it a habit, perhaps once a month, in a well-lit room. Use a full-length mirror and a handheld mirror to check every part of your body: front, back, sides, arms, legs, even between your fingers and toes. Don't forget your scalp and neck, and get a loved one to help you check your back. Or use your phone to snap photos of hard-to-see areas. The key here is consistency and getting familiar with your own skin's unique map of moles and freckles. That way, any new or changing marks will stand out to you. If you spot any of these ABCDE signs, or anything that just looks off or doesn't seem right to you, the actionable step is simple: don't wait. Schedule an appointment with your doctor or a dermatologist. They have the expertise and the tools, like a dermatoscope, to examine these spots more closely and determine if further steps, like a biopsy, are needed. Early detection, my friends, is absolutely paramount when it comes to skin cancer. It means simpler treatments, better outcomes, and often, complete removal with minimal fuss. Now, while those ABCDEs are incredibly important for moles, sometimes, silent signs aren't about a mole at all. They might appear in ways we least expect, often mimicking common, harmless skin conditions. One such often missed sign can simply look like a persistent sore or a patch of rough, scaly skin that just won't heal. We've all had little cuts, scrapes, or even a stubborn pimple that takes a while to disappear. But what if a spot appears and just seems to linger, refusing to scab over and heal like a normal wound? Or perhaps it heals a little, then breaks open again. This is a classic presentation for two of the most common types of skin cancer: basal cell carcinoma and squamous cell carcinoma, which are far more prevalent than melanoma but still require attention. A basal cell carcinoma might appear as a pearly or waxy bump, sometimes with visible blood vessels, or as a flat, flesh-colored or brown lesion that can look like a scar. It often has a tendency to bleed easily, especially after minor trauma, and then form a crust, only to reopen. It's like a wound that just can't quite mend itself. Similarly, a squamous cell carcinoma might show up as a firm, red nodule, or a flat, scaly, crusty lesion. These can sometimes be tender or painful. The key commonality for both of these, and why they're often missed, is that they might not look like the scary, dark mole we often associate with cancer. They can look like a persistent pimple, a scratch that won't go away, or a patch of dry skin. But the defining feature is their stubbornness. They simply don't resolve like a normal skin issue within a few weeks. If you have any sore, bump, or patch of skin that persists for more than 4 to 6 weeks, particularly if it bleeds, oozes, or crusts, it needs to be checked by a doctor. Think of Mrs. Henderson, who had a small, pearly bump on her nose for months that she thought was just a stubborn zit. But it kept growing slowly and eventually bled. It turned out to be a basal cell carcinoma, thankfully caught early enough for simple removal. Her only regret was waiting so long. Beyond a non-healing sore, another silent signal is a new, unusual growth or bump that doesn't fit the description of a typical mole or freckle. This could be a waxy or pearly bump, like a tiny translucent bead, or a firm, red lesion that feels different from the surrounding skin. Sometimes it might be a new red spot that looks a bit like eczema but doesn't respond to moisturizers or steroid creams. These aren't necessarily dark and scary, but their novelty and unusual texture or appearance are what should catch your eye. It's about recognizing something that simply doesn't belong on your skin's usual landscape. Then there's the persistent itch, tenderness, or even pain in a specific spot. Even if the visual appearance doesn't seem alarming, many people think skin cancer must be visible. But sometimes, the first sign is a change in sensation. If a particular mole or an area of your skin starts to itch intensely, becomes tender to the touch without any injury, or even feels consistently painful, this can be a quiet indicator that something is amiss beneath the surface. It's not just a general itchiness of dry skin. It's a localized, persistent sensation that draws your attention repeatedly to one particular spot. It might itch more at night, or feel like a constant prickle. Don't dismiss these sensations, especially if they're new and not easily explained by something else. Another subtle but important sign relates to a change in texture. While some skin conditions naturally cause roughness, if you notice a patch of skin that suddenly becomes scaly, rough, or develops a crust, and it doesn't clear up, this could be a form of skin cancer, especially squamous cell carcinoma, or even a precancerous lesion called actinic keratosis. These often feel rough to the touch, almost like sandpaper, and they commonly appear on sun-exposed areas like the face, scalp, ears, neck, and backs of hands. If you run your hand over an area of skin and consistently feel a rough patch that doesn't respond to regular moisturizing, it's worth a professional opinion. It might just be sun damage, but it could be more. And now, for one of the most surprising silent signs, something many people would never think to check: dark lines under your fingernails or toenails. This might sound strange, but a new, persistent dark streak or band under a nail, especially if it's wider than 3 mm or changing, can be a sign of a very serious type of melanoma called subungual melanoma. It often starts as a thin, brown or black line and can gradually widen or darken. It's often mistaken for a bruise, especially if you've recently bumped your nail. But unlike a bruise, it won't grow out with the nail or fade over time. It can also cause the nail plate to lift or crack. This is one of those hidden spots that can be deadly because it goes unnoticed for so long. It's absolutely vital to be aware of this, especially since these melanomas can be quite aggressive if not caught early. So, when you're doing your checks, take a moment to look at your nails. 2. Both fingers and toes. Any new, unexplained dark line, especially one that spreads to the skin around the nail, needs immediate attention. Remember, the overarching theme here is change and persistence. If you notice anything new, anything changing, or anything that simply won't heal or go away, it's a message from your body that you shouldn't ignore. Don't self-diagnose based on pictures online. See a doctor. They are your partners in health, and catching these things early makes all the difference in the world. Now, next, we'll dive into how all this information fits together and what concrete actions you can take to empower yourself. We've covered quite a bit today, haven't we? From those distinct, patterned changes in moles, remembering asymmetry, irregular borders, varied colors, and the crucial element of change in any existing mole, to the more elusive, persistent sores or bumps that just won't heal, or perhaps a lingering itch or tenderness that doesn't make sense. We even touched upon something as seemingly minor as a persistent dark streak under a nail. It's a lot of information, and it can feel like a heavy burden to remember all of it. But please don't feel overwhelmed. The goal here isn't to make you anxious every time you see a freckle, but to equip you with the power of awareness. Think of this as your personal health detective kit, a set of tools to help you advocate for your own well-being. Small changes in your routine, like committing to a monthly head-to-toe skin check, can make an enormous difference in detecting potential issues early. This means setting aside a specific time, perhaps after a shower, to really look at your skin in good light. Use a full-length mirror for most of your body, and a hand mirror for those tricky spots like your back, the back of your neck, and your scalp. Don't forget often overlooked areas: the soles of your feet, between your toes, even under your nails, as we discussed. And yes, even areas usually covered by clothing or hair. You can ask a trusted family member or friend to help you check your back and scalp. Taking photos of moles you're concerned about, with a ruler next to them for scale, can be incredibly helpful for tracking changes over time. Just remember to use consistent lighting and angles for your comparison photos. Early detection, my friends, is truly your best defense against skin cancer. When caught early, before it has a chance to spread. Skin cancer is often highly treatable, often with simple procedures that can be done right in your doctor's office. This means simpler treatments, better outcomes, and far less worry down the road. You are your own best advocate, and by paying attention to your body, by listening to those quiet whispers from your skin, you're taking a proactive step towards a longer, healthier life. It's about empowering yourself with knowledge, not living in fear. It's about building a partnership with your body, recognizing that it communicates with you in subtle ways, and learning to interpret those messages. And that surprise I mentioned earlier, the one that truly catches people off guard. It's this: many people believe skin cancer only appears on sun-exposed areas like your face, arms, or legs, believing it's purely a result of sunburns or extensive sunbathing. But the truth is, these silent signs can appear anywhere on your body. Yes, even on areas that rarely, if ever, see the sun. Think about the soles of your feet, between your toes, under your fingernails, on your scalp hidden by hair, inside your mouth, or even in unexpected places like your armpits or groin. This is why a thorough, head-to-toe self-examination, regularly and in good light, is not just helpful, but absolutely vital. It's about more than just sun damage. It's about any abnormal growth or change, wherever it may be hiding. This is why you need to know your skin from head to toe, because cancer doesn't always play by the rules we expect. We'd love to hear from you. Have you or a loved one ever had a skin change that turned out to be more serious? Perhaps a spot you initially dismissed, but then decided to get checked. Sharing your experiences in the comments below can help so many others who might be feeling uncertain or hesitant. Your story could be the very thing someone needs to hear to take action for their own health. It builds a community of support and shared wisdom. And if you found this video helpful, if it gave you some clarity or simply reminded you to pay a little more attention, please give it a thumbs up. It truly helps our channel, and it lets us know we're providing valuable content. Also, consider subscribing to our channel. We're here to bring you more practical, encouraging content to help you navigate life's journey with confidence and well-being, covering a wide range of topics that matter to you. Remember, every day is a new opportunity to embrace life, to explore, to enjoy, and to live with vitality. By staying informed, by being vigilant about these quiet whispers from your body, you're not just preventing potential problems. You're actively choosing a path of greater health, peace of mind, and the freedom to live your very best life at every age. Take care of yourselves, dear friends, and cherish every moment.